Hello, I'm Greg Jamian, and welcome to Home Health Care Corner. As more people receive their medical services and care at home, there are many questions that pop up that sometimes require quick answers. I have put together a series of short segments with healthcare professionals that will help explain how things work, along with answers to common questions found in home-based care. I hope you find the following information helpful.
Hi, my name is Janet. I'm a clinical supervisor at AmeriStaff Home Health Care. I'm here today with Erin, and we're going to discuss low vision problems. As our population is growing older, all those baby boomers are getting older, you're hearing more and more things about low vision problems, and that's because 1 out of 3 people over the age of 65 will have some kind of vision problems once they reach that age.
Well, what are the common types of vision problems?
For the elderly, the biggest one that you hear about is age-related macular degeneration. Mm-hmm. There's also commonly, I know a lot of people for a long time have heard about cataracts, mm-hmm. glaucoma, and there's also a rising number of, it's called diabetic retinopathy.
Oh, okay.
So today I want to kind of go over each one of those things to kind of tell people what to look for.
Okay. So what are the common symptoms of each one?
Well, macular degeneration, usually it's a problem with the back of your eye, and what it does is, it's like the lens on your camera and how you take a picture and it sends that picture to your optic nerve. Mm-hmm. Well, that gets damaged over time, and so you lose those ability to see the fine lines. So people with macular degeneration sees blurry vision, or they can see objects, but they can't
quite make them out.
Yeah, focus on the fine details.
And is that due to age?
Yes, it's due to age.
Okay.
And it's related to heredity, environmental things that are happening in our environment that's causing that. And a lot of times that the patient can see objects out there, but they can't see your facial features.
Okay, so it's kind of just like a blurry mass. Okay.
Yeah, so that's one of the first symptoms or later symptoms of it.
Okay.
The second one is glaucoma.
Mm-hmm. That's one that you hear about more commonly.
Right,
mm-hmm.
And it has to do with the pressure in your eye, and the pressure in your eye tends to damage that optic nerve that sends the impulses to your brain so you know what you're seeing. Mm-hmm. So the biggest thing for that is just get regular eye checkups.
Okay.
For that one to determine.
When you say regular, do you mean annually, every year?
Yes,
okay.
Definitely. And they do that puff in air in your eye, and it shocks you, right? But that's how they determine the pressure in your eye.
Okay.
And it's very treatable if it's caught early, mm-hmm. So that's a good one to do.
Okay.
That one is usually, you don't have a lot of symptoms with that before it, mm-hmm. So that's why the
annual checkups are so
right.
important. I know a lot of people get really nervous about that puff,
Right. And unfortunately, the people that are affected are really people with hypertension and diabetes.
Okay.
Are more prone to that, mm-hmm. People as they get older too.
Okay.
The other one that we commonly hear a lot about is cataracts.
Mm-hmm.
Cataract surgery is on the rise, and it's because you get the lens that you see out, like your camera, gets fogged over. So if you imagine when you're taking a picture on your camera, that lens, if it had like a gray film over it, mm-hmm. or needs to be cleaned or something like that, mm-hmm. That's what you see. So you start seeing, that's a slow progression, mm-hmm. And you start seeing like a little bit more blurry. Also, your peripheral vision more is affected with cataracts. You can't see that as much. So it's the most common cause of blindness, though, cataracts,
really?
in the world.
So if you don't have it taken care of, you could become blind
Yeah,
permanently.
because your whole lens of your eye, what you see out of, can get covered with those plaques, and so then you can't see.
Wow.
So the common thing with that is really surgery ends up being, but they have to wait till you get to a certain point, and then they remove that lens and they'll put like a permanent contact lens in your eye. It's relatively painless surgery. You can have it done on an outpatient basis.
Okay.
But of course, if you're having any problems with your vision, first and foremost is you need to contact your doctor, your eye doctor, your physician, tell them the problems that you're having, and then they can send you to the right direction.
Okay.
The other one that we're going to talk about is diabetic retinopathy. With the cases of diabetes rising in our country, more people are having this. And this is where the teeny blood vessels in the back of your eye, they burst or they hemorrhage, and it causes bleeding in the back of the eye. So then that affects your vision.
So you wouldn't necessarily know unless your vision was not right. You wouldn't know.
Yeah,
with the bleeding
it's long. Like you wouldn't notice in the beginning when it's first happening, but especially if you're diabetic or you have any high blood pressure or kidney problems, you make sure you're going every year to have your eyes checked, because that's something that they can do in the at your eye doctor. They can do that test for it. I know when I just went to get my glasses, they asked me if I wanted to have it done, and because a lot of times it's not covered by insurance. But if you have any of those diseases that might make you prone to it, you should really invest in it, because your eyes, you know, if you can't see, that's everything. It's worth the investment. So.
Absolutely. Now, is there anything you can do around the home if you are experiencing any of the problems to kind of help you, so you can live a little bit, even if you're dealing with an issue, you're not tripping over things, proper lighting in the home?
That's a big one. Proper lighting. Make sure the lighting is good in your home. If you're straining your eyes to see, that puts more pressure on the eye and can cause further problems. You can use magnifiers.
Oh, okay.
A lot of people with macular degeneration, it's part of us getting older, So there's magnifiers that you can get through companies, so it puts less strain on your eyes.
Okay.
And also, if you have write in big black marker instead of a pen, you can put notes up on their refrigerator so they can see things. A lot of people have problems with the stove, seeing high, medium, and low, because it's so small on the dials. You can put like tape, fluorescent tape, because they can still see that, like the orange duct tape that you see out there, or the yellow duct tape. Also, for peripheral vision is using the steps, like going down their steps. They can't see and they might miss that step. So you can use that orange duct tape,
the really bright tape,
on the edge of the steps, so they can see that, so they know that that's where the step ends. Even going down out of their house, they can put it on,
And that's so important because, fall hazard.
Very good, yes. Another thing is to remove clutter in the home, so they're not tripping over things. If clear pathways, kind of keep everything out to the side. Large print books, there's out there for the library. There's also books, like books on tape. So if they have vision problems, they can at least enjoy listening to books, that kind of stuff. Decreasing the glare. So sometimes the sunlight coming in, it would be better to shut that blind and turn on the lights so they get that.
So there's still light in the home, but it doesn't have
It's not that glare, yeah. Also, if you're a smoker, a big thing is to quit smoking, because it affects those teeny blood vessels in the back of your eye, and that would really help to prevent some of the stuff you're doing.
Okay.
So.
Well, this was really helpful, Janet. Thank you.
Thank you. If you have any further questions, you can contact us at AmeriStaff, 248-288-2270, or contact your physician.